Remember, basic sciences are not mixed, are not really, they're not clinical medicine. And what makes a doctor is how knowledgeable are they in terms of their clinical understanding, clinical acumen. It's all about clinical. Your clinical understanding, clinical reasoning, clinical acumen. That's what makes a doctor. It's not your basic sciences. Yes, they're important, but it's not that. What helps you in front of a patient is your clinical judgment, clinical reasoning, clinical acumen, your clinical approach, how you approach cases, how you approach symptoms, and all of that. And that's why I have got this channel, Clinical Medicine with Dr. T. I my intern as an intern. I loved it from school. I've always loved it. I enjoyed it in my final year, but during my internship, I'm not gonna lie, didn't enjoy it. Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, in this video, I'm gonna be doing my internship experience, my own personal internship experience. So I've written a few questions down. I have them here. So I'll be answering these questions just to make sure that I don't leave anything that I wanna talk about. Just to make sure that I don't leave it out. So before I start, so guys, for those who don't know, I graduated in 2019 from UP, which is Pretoria University. So I started my internship last year, 2020. So this year, 2021, I'm a second year intern and I'm just finishing. I'm left with only this month, which is December. Then next year I'm gonna be starting my community service. So guys, as much as we are like in my group, like as much as, or let me say, for those who started their internship the time I started my internship, as much as we are in the same hospital, our experiences are not exactly the same. We have different experiences. There are some similarities then there, but we still have a lot of differences, different experiences. It's even worse when you wanna compare an intern who if you wanna compare two interns that did their internship in two different hospitals, even in the same province, in the same district sometimes, or even in the same, in the same province. It's even worse when you are trying to compare two interns who finished the same or who started their internship at the same time, but they work in two different provinces, or so the experiences will be different. But in this video, I'm going to talk about my experience. So guys, for those who don't know, I'm doing my internship in the Eastern Cape, Mthatha, at a hospital called Nelson Mandela Academic Hospital. So this hospital is in a small town of Mthatha, like I said. And the first question, why did I choose to come to Mthatha, to come to Nelson Mandela Academic Hospital? maybe before I answer that, let me just congratulate you guys for your placements, and I hope you guys got what you wanted. And for those who didn't get what they wanted, the places that they wanted, or the hospitals that they wanted, I hope the swapping is going well, and that you will actually, or you will eventually get what you want. And good luck for next year. I'm gonna keep posting videos that I think will help you in your internship. And if you have not subscribed, please consider subscribing. You subscribing motivates me a lot. It makes me to wanna do more and more and more and more. So thank you so much, guys. So the first question was, where did you study? When did you finish? Which I've answered. I was in UP. I graduated in 2019. Started my internship in 2020, and now it's 2021. I'm finishing my internship, which is 2 years. Why did I choose to come to Nelson Mandela Academic? Nelson Mandela Academic was my first choice, and the reason for that is because I wanted to come back home. So I had been away from home. I've been away from home for over 10 years before I came, obviously. So I wanted to come back home. It wasn't about the academics. It wasn't about any other thing that you can think of, except for I wanted to come back home, and also I wanted to start working on my other life, which is agribusiness. I love agribusiness so much. So I came back home because of those two reasons. Okay, so how was the second question? How was the transition from being a student to being an intern or to being a doctor? For me, it wasn't a struggle. Or let me say it wasn't a big struggle. It wasn't something that I didn't expect. It wasn't it wasn't difficult for me. And the reason for that is because, first of all, some of you, and some of you don't know, some of you know, I'm a postgraduate. So before I went to UP, I had been working for about 2 years as a clinical associate, or 2.5 years as a clinical associate. Maybe I will talk about what a clinical associate is, and how did I end up there, and what did I learn there, and how, and why did I leave, and I'll just talk about clinical associates. So I was a clinical associate, and so when I started my internship, the environment wasn't foreign to me. The running of the hospital wasn't foreign to me. The flow of patients, just understanding that environment wasn't foreign to me. And also, I had a bit of experience. I knew a little about some conditions. So when I was a clinical associate, I knew some conditions. Obviously, my knowledge was not deep as that of a doctor. I wasn't deep enough to fully understand things, but I had an idea of things. So it wasn't foreign to me. So I didn't struggle. And as a clinical associate, I have been on call as a clinical associate where I was working. I used to do calls, let me put it that way. So being on call wasn't, but obviously, yeah, the internship calls are heavier than what we used to do. And I was used to being in OPD. I was used to being in the wards. I was used, even though my knowledge wasn't wasn't that deep. It wasn't that extensive. I just knew. I think I just knew a little bit of most of the things that we saw where I was working. So that's number one. Number two, the SIC program that most universities do is quite helpful. So in UP, we started our SIC program in fifth year in June. So SIC for us was 18 months. It was the second half of fifth year and the entire sixth year. That was the SIC program. So which is student intern complex. So you work like an intern even though you are a student. It was intense. It was intense because we used to work like interns. We used to manage patients. Like you as an SIC student, you are always allocated patients that you had to take care of, and it would depend the number of patients. Whether you get 5, 6, 7 patients, 8 patients, it was always dependent on how many patients are there and how many are you in your group. So we used to have about 6, 7, 8 patients that we had to know everything about, know their diagnosis, study around them, trace their bloods, take their bloods, trace their bloods, present them when the consultant comes. When the consultant came, they never asked the intern questions. I mean, in Kalafong and Steve Biko, interns are not asked questions at all. So it was always SIC, ICC, and then registrars. So, but if there's anything that was not done on a patient, they used to ask who's the SIC that is taking care of this patient. Then they would ask you. So even with the thing of tracing the bloods, we used to have logging in details. I mean, I know guys, I'm sure you know the initials app that everyone has it on their phones now. So as students, we never had that, but we were given logging in details. So we were asked to download that app, and the doctors would give us their logging in details because we didn't have them. All in the name of making sure that we trace the patient's results and we write them in the files. And this thing of organizing a flow chart, making sure that all the bloods are updated there and how you write bloods and that kind of a thing. So we used to have, so that taught us a lot of responsibility. It taught us a lot of responsibility. I remember in Ops and Gynae, let me say in Gynae, we used to come to hospital at like 6:30, sometimes 5. Some people came at 5 because what you wanted to see your patients not under pressure, so that by the time the registrar come at 7 or 7:30, you have already seen all your patients. And whether you go there at 5 or 5:30 or 6 or 6:30, it was always dependent on how many patients you have and how comfortable are you with your patients and how well do you know your patients and all of that, and how much work do you still need to do. So it was crazy. And also internal medicine, I remember there was a time I had like 8 patients. There was a lot of patients with internal medicine. And yeah, but that taught us a lot. When we were still students, SIC students, we thought that that program is like, it's enslaving. So that's what we thought. We thought like it's too harsh, it's too that and that and that and that. It's exhausting, it's unfair, and all that. So that's what we thought. But now when we look back and reflect, we're like, oh, okay, that program actually helped us a lot. Because, that's why I have got this channel. It's about clinical medicine. Clinical medicine. If you can attend from first year to sixth year, go to classes every day and not go to hospital, there is no way you'll understand medicine. There's no way you will be a doctor that you want to become, because it's all about clinical medicine. Because the SIC program introduces you nicely into clinical medicine. Remember, basic sciences are not really, they're not clinical medicine. And what makes a doctor is how knowledgeable are they in terms of their clinical understanding, clinical acumen. It's all about clinical. Your clinical understanding, clinical reasoning, clinical acumen. That's what makes a doctor. It's not your basic sciences. Yes, they're important, but it's not that. What helps you in front of a patient is your clinical judgment, clinical reasoning, clinical acumen, your clinical approach, how you approach cases, how you approach symptoms, and all of that. And that's why I have got this channel, Clinical Medicine with T, to help you guys with clinical medicine. Okay, so those are the two reasons why my transition from being a student to being an intern was not so difficult for me. Next question, my rotations. So my rotations, when I came, I started with surgery, then I did obs and gynae after, and then I did peds, and then I did internal medicine. So those were my rotations for my first year of internship, and all of them were 3 months. And then in my second year of internship, I started with family medicine for 6 months. I did my first 3 months in a district hospital, and then I did my other in the central hospital, which is like it's a regional now, but people still like to call it a district. So and then after that I did 2 months of psychiatry, 2 months of anesthesia. Now I'm doing my 2 months of orthopedics. So that's how my rotations have been structured. So the next question, what has been my favorite rotation? Favorite rotation? First of all, I love internal medicine. I love internal medicine so much, and I don't see myself doing any other thing other than internal medicine. So the rotations that I liked, funny enough, I didn't enjoy my internal medicine as an intern. I loved it from school. I've always loved it. I enjoyed it in my final year, but during my internship, I'm not gonna lie, didn't enjoy it. It wasn't nice for me. But I'm just gonna leave it at that. So one rotation that I've enjoyed, so actually I've enjoyed 2.5 rotations, and I'll tell you why I say 2.5. I enjoyed anesthesia. I'm not a very big fan of anesthesia, but it's something that I just know that I need to know. So I enjoyed it a lot. The anesthetic department in Nelson Mandela, for me, is the number one. It is the best. I mean, it is the best rotation. I learned so much there. And I mean, you know, when you start a rotation, you're not gonna be introduced to everyone. They won't tell you that, okay, this one is an MO, this one is a registrar, this one is a second year registrar, this one. No, they won't tell you that. So when you come into a rotation, you sort of like have to quickly find and quickly know the people, know who's the consultant. Sometimes the consultant will not gonna be there when you come. So you're still trying to find out who's who, so that you just know who's who and all that. In anesthesia, when you go there, I took about 2 weeks, if not more, to figure out who's who. I couldn't tell who's an MO, who is a registrar, simply because of how good those guys are. It's not easy to tell. They are equally as good. It's only later on that you find out, okay, you even get shot that so-and-so is not even a registrar, but the way she's good or the way he's so good. So it's the number one rotation that has impressed me in Nelson Mandela Academic. I enjoyed it. I learned a lot. And the medical officers there, I mean, were always willing to teach us. They were always willing to show us stuff. And I mean, anesthesia is one of those rotations that are just like scary. You know, when you enter theater and then you look at those machines, but when you get there, they teach you, they show you, they break it into components. So it doesn't now become a big machine that is just so scary. It's just components that have been put together. So when you understand it like that, it becomes easy to operate even the machine. So so big up to you guys. Big up to you guys. And we don't always appreciate each other in the medical field, but in this video, I just want to appreciate you. Thank you so much, guys. Thank you, Tom. Thank you so much. And I know that a lot of interns, they do share the same sentiments. Some of them you're never gonna hear them say it. Some of them you're not gonna have an opportunity to meet them, and then some of them will not actually tell you. But I know they do share the same sentiments. So guys, thank you so much. And also they've got a very nice, I don't know if I can call a curator or what, the doctor who was looking after interns. Like, she's so nice. She just knows how to handle interns. She just knows how to handle interns. And so in that kind of environment, it's very easy to learn. It's I mean, so easy to learn. The work was exhausting. The work was not easy. It was exhausting. I mean, anesthesia is exhausting. And I mean, people think that you just make the patient sleep and then you sit there, you write notes. The fact that you work there from, say, you got in at 4:30 and you work throughout the entire night until 7:30 in the morning, I mean, those are normal hours. But when you are learning something, I mean, you push because you can see that you are learning here. So guys, thank you so much. So that's the first rotation that I enjoyed. The second one that I enjoyed is family medicine. And the reason why I enjoyed family medicine is because I went to the district and I saw the setup in the district. Not that I was really foreign, but I was able to practice some of the things that I had already learned. I did scissors in the district. I did anesthesia in the district. Actually, I did anesthesia before I did anesthesia in the districts. I got a chance of being in maternity again in the districts. I got a chance of going to peds again when I was in the district, because I rotated in peds in the district for 3 weeks, 3 weeks. And I had an opportunity to be on call again in the districts. I got a chance to be in OPD and all of that. So when I went to the district, it was like a revision for me, because those big rotations, they did help us a lot. Remember, the big four, you do them in your first year. They sort of like prepare you for your family medicine, which is gonna be in the districts where you're gonna be seeing everything. So that prepared. So the only thing that is missing there is orthopedics, which you're also gonna see in the district when you go there. So I enjoyed family medicine. That's the first reason why I enjoyed it. The second reason why I enjoy family medicine is because there's a lot of internal medicine in family medicine. I think about 80% of the patients that you see in FemMed, or maybe 70, they're internal medicine patients. So I enjoyed it. And also, I enjoyed seeing different patients, like different populations, different conditions. Seeing a fracture, and then the next one that comes in is a pregnant, privy bleeding. So I enjoyed that. So I enjoyed my family medicine a lot. The third one that I enjoyed is peds. And when I say peds, I enjoyed peds, but I enjoyed neonates more. And the reason why I enjoyed neonates more is because of, there's one doctor there that I'm just gonna mention her name, Dr. Mayer. She's one of those consultants that will build your confidence. She's so good. She's such a consultant. That's what I can just say. She's just a consultant. I mean, and she's patient with you. builds your confidence. And I mean, in that kind of environment, at some point I felt, no, if I were to do peds, I would love to have a consultant like that. I mean, she's a consultant that I feel you can go to war with. You can, I mean, you can break your leg for. She's like that. So I enjoyed neonatology a lot, even though a lot of us didn't want to go to neonates, but we were all forced to go. But we came out there being confident with a lot of things that when we got there, we knew nothing about, or we were shaky about, and all of that. So yeah, those are rotations that I enjoyed. The rotation that's the next question now, that I didn't like, or I liked the least, is orthopedics, which I'm doing now. The reason why I'm not enjoying orthopedics is because I'm not a theater person. Number one, I'm not a theater person. I don't like theater. I just tolerate theater. The long hours, the ortho operations, most of them are always long, and sometimes you can just do 2 cases in a day, and you feel like you've just done only 2, and maybe you had a very long one which took like 4 hours or whatever. So I mean, I don't like orthopedics, guys, because of theater. I don't have a problem with orthopedics in the outpatients department. I don't have a problem actually for orthopedics. Actually, I got a distinction for orthopedics, but remember, it's not the operative part of it. I don't like the operative part of orthopedics. I don't have a problem seeing fractures. I don't have a problem assessing fractures, assessing patients who have got fractures, and all of that. I don't have a problem putting up POP, back slabs, all of that, irrigating wounds, open fractures, all of that. I don't have classifying. Actually, I love classifying fractures. If you can go to my if you go to my channel and you go to playlist, and then you look under orthopedics, you will find some nice tutorials there. I don't have a problem with the entire orthopedics, but the operative part, just don't like it. Yeah. So, and the second reason why I'm not enjoying it, it's obviously things that I don't want to talk about on this video. It's just those depressive things that we want to talk about, and you just want the rotation to just finish. You try to learn what you can learn, and you just want the rotation to finish, and then that's it. Yeah. So what have been my lowest moments during the 2 years of my internship? Depressive moments. There have been a couple of them, but I'm gonna just tell you about one. Let me just say this is the most depressive one. So guys, what happened to me last year? Let me just make sure that I pose nicely for this, what I'm gonna tell you. So guys, last year in one of the auditions that I was doing, what happened is I went to Pretoria for a weekend, and then when I was supposed to come back on Sunday, it was when this thing of Corona was starting. So I got to the airport, and there were so many processes that were, before I could even get to the boarding gate, there were a lot of paperwork that had to be done. that was just in line with the pandemic. So that took me quite some time. I didn't expect it, but it took me a lot of time, such that when I went to the boarding gate, I couldn't check. I did check in online, but I couldn't. I just couldn't. Sorry about that. So I couldn't. I couldn't go through the boarding gate, and I was told that I'm late. So what I did is I sent